The American Heart Association Healthcare by Food Initiative has funded 20 grantees around the country who are doing studies in food as medicine. We brought them together over these 2 days to learn from one another and to think together about some of the gaps in the field and how to best address them. We see a lot of opportunity to help the healthcare sector think differently about the underlying economics of healthcare.
Bringing a lens to the voices in the room that's not just academics and researchers, but real-time, real-world perspectives of what's working, what needs to be working. How do we understand the patient's voice, the provider's voice?
Collaborative studies are really very important. And the American Heart Association really had the foresight to say, for these initiatives to really benefit all, they need to be done in partnership with communities.
Pulling all these different contributors together in a collaborative effort is exactly what's needed because it's such a massive problem. So pulling folks with different strengths and abilities is going to be key to pulling off how best to provide healthy meals to those who are in most need.
We're going to be able to track these things with this consortium approach and really see what's working for different individuals across the country. It's not saying that food is replacing medicine. It's saying that food should be a partner in all of our healthcare and in medicine, especially for those that need it.
As we try to address food access issues, there are other social needs that people may have.
Evidence research is the lifeblood of policy change, and so that's why we're excited about participating in this.
There isn't one question that needs to be answered. There are a lot of questions. There are a lot of different approaches to this. One of my favorite phrases is embrace the variability.
We have an opportunity to address some of the challenges we have within the U.S. healthcare system. We spend more than any other country in the world on health services. We rank 45th in life expectancy. We need to figure out how do we get further upstream? How do we be more proactive in preventing disease rather than just using a lot of healthcare dollars to treat disease after it happens?
We want patients to have access to food as medicine interventions as a covered benefit. We want it scalable, we want it widespread adoption, and we want it sustainable. And this is why we do what we do.